in this lecture I am going to discuss about the social health program. Here we will discuss about what are the social health programs, the launched year and their objectives, means what they are focusing on. Okay. Then we will see the role of WHO in social health program. So, let us start. With the very first National Cancer Control Program, and this program is launched in 1975. Okay. The primary or objectives goal is the primary prevention of cancer by health education, okay, regarding hazards of tobacco consumption and necessity of genital hygiene for prevention of cervical cancer or other types of cancer as well. Okay. Then there is a program, national program for prevention and control of deafness, okay, which is also known as NPPCD. It is launched in 2007. Okay, with the name we are very clear what we want. We want to prevent the deafness. We want to control the deafness. Okay. So, to prevent the avoidable hearing loss or to prevent the injury, okay, to prevent the numbers or the complications associated with deafness as well. So, this was the goal here, okay, under the National Program for Prevention and Control of Deafness, which is launched in 2007. Then there is one program, District Mental Health Program, okay, which is known as NMHP, okay, National Mental Health Program. It is launched in 1982. Okay. So, mental health is a major concern. Okay. Mental health consists of many of the diseases, okay, like depression is there, anxiety is there. Okay. So, we want to ensure the availability and accessibility of minimum mental health care for all, okay, for all age groups regardless of their socio-economic status in a foreseeable future, particularly to most vulnerable section, okay, the most vulnerable society or the most vulnerable area and underprivileged section of population, the tribal areas, okay, the underserved areas. So, for those of the areas we want the facility, it should be provided to those sections also. Okay. Then there is another program which is known as a National Cancer Registry Program. Okay. What it is doing? It is launched in 1982, okay, and this program is for tracking the cases, cancer cases. Okay. So, it is providing the true information on cancer prevalence and incidence. If we are saying prevalence and incidence, what it means? Prevalence means how much the cases we have reported till date. Okay. And if we are saying the incidence, means the number of new cases which are emerging in a particular period of a time, within a 1 year or a 2 year or a 5 year or a 10 year. Okay. So, number of new cases which are emerging in a particular time is the incidence, and the total number of cases up to the date is the prevalence, okay, for a particular period. So, these are some of the programs, okay, like for the cancer, for the prevention and control of deafness, and for the mental health. Okay, there is a registry program which is tracking on the cancer cases. Other programs like National Leprosy Eradication Program. Okay, leprosy is also one of the disease. Okay, and to control this leprosy, which is caused by the Mycobacterium leprae. Okay. There is a skin infestation in this particular disease, and this is a stigma also in the society, if we will say. So, here this program is for the prevention of this leprosy. That program, National Leprosy Eradication Program, it is started in 1955, okay, and It is launched in 1983. Okay. What is the main objective of this program? Is to arrest the disease, means to eradicate, to stop the disease. Activity in all known cases of leprosy, because it is taking a lot of time to show the signs. Okay. That is why it is difficult to difficult also to find out those of the cases. So what we want here is to stop those of the cases which are with the leprosy. Okay. Then universal immunization program. This is a very important program. Under this program, there are immunization policy. Okay. Means the vaccination, what type of vaccinations are provided at which age. Okay. At the birth, or at the 1 month, or at the 1.5 month, or 2 month, or 3 month, or up to the 5 years. Okay. Like this. So, universal immunization program are showing the standard vaccines which should be given to the child. Okay. For the proper health of the child. So, it is launched in 1985, universal immunization program, and it is achieving the self-sufficiency in vaccine production. Okay. Standard vaccine should be there, and in the quantities which is required for the population. So, to achieve self-sufficiency in vaccine production and manufacture of cold chain equipment for storage purpose. On the ground level, we require the vaccination to give in the rural areas, okay, in the village areas where the ASHA workers, okay, or the ANMs are providing the vaccinations to the child by going direct home to home. Okay. They are seeing, they are evaluating the child, and then they are providing the vaccination on the basis of status the child has. So, for that what they required the storage facility, the cold storage facility for storing the vaccines under those of the storage conditions. So, there should be a proper production of these of the things, okay, manufacture of cold chain equipments. Okay. Then there is a National Vector-Borne Disease Control Program. This program we have covered already in previous lecture. Okay. The National Vector-Borne Disease Control Program is consisting one big area, that is a malaria prevention. Okay. And this is launched in 2003. This is integrated program. This is covering many of the diseases, vector-borne diseases like filaria, dengue is there, Japanese encephalitis is there, malaria is there, okay, dengue is there. So, all of the diseases are covered in this National Vector-Borne Disease Control Program. This is the integrated program for the vector-borne disease. Now, the main goal is for this program is for the prevention and control of vector-borne diseases. Okay. Then there is a next is the National Tobacco Control Program. Okay. National Tobacco Control Program is launched in 2007, and it is for preventing the initiation of smoking among young people, to educate the people, to motivate the people not to use the tobacco, what are the burden associated with the use of tobacco, what are the benefits of quitting the tobacco, and how to quit the tobacco. So, these all of the things are written, or they are presented under the National Tobacco Control Program. Okay. Then National Program for Health Care for the Elder. Okay. This is one of the program we have already covered in the previous lectures also. So, this program is launched in 2010, and it is providing the preventive, okay, prevention of disease, okay, curative part also, means if the patient is suffering from any disease, so cure it, to provide the treatment, okay, in geriatric population, because this is for the elder people we are saying, yes. So, to provide preventive, curative, rehabilitative services to the elder persons at various levels of healthcare system. Okay. Sub-centers, district healthcare centers, community healthcare centers, regional healthcare centers, for all of the levels there should be facility for geriatric healthcare. Okay, either it is a bi-weekly or the weekly or the weekly clinics are there, or there is a dedicated healthcare facilities. Then see, on the conclude basis, we have covered the programs and their launch year and what are the objectives. Then after that we will see what is the role of World Health Organization in National Health Program and how India is connected with it. Okay. So, World Health Organization, that is the WHO, is the United Nations specialized agency for health. Okay. So, this is regulating all of the standard policies, okay, making all of the treatment strategies, standard treatment policies, and also tracking the data of the disease, demographic profiles of the diseases. Okay. Implementation of the program is also what WHO is doing. So, this is one of the areas the WHO is working on. It is an intergovernmental organization and works in collaboration with its member states, usually through the Minister of Health. Okay. So, it is working with many of the countries and India is also one of them. The World Health Organization is responsible for providing leadership on global health matters, like in the COVID we are seeing how the WHO is working. Okay. So, it is, you can say, the leadership on global health matters. Shaping the health research agenda. What should be the health research agenda is there? Setting the area norms and standards. I told you the same. Okay. It is providing the standards, it is providing the norms, okay, articulating the evidence based policy. It is not just on the verbal basis the WHO is saying yes, we should follow these standards or the rules. It is all the evidence based, okay, it is all the data based. Okay. So, there should be a evidence based policies the WHO is giving, or the options or the choices the WHO is giving. Okay. And on that basis the country is following their own standard treatment guidelines, okay, on their own treatment strategies. Okay. Providing technical support to countries and monitoring and assessing health trends. Okay. Not only the standards or the norms for treating a particular disease the WHO is giving, WHO is also monitoring the data. Okay. Monitoring the data regarding the demography profile of a particular disease, like in example if I will say the COVID, how many cases are coming in a particular country or in a particular region. Okay. The vaccines the person is taking, it is effective, and after that we are saying there is a reinfection. Okay. So, that all of the things are reported, how many persons are getting the vaccinations, how many are getting the reinfection, how many are emerging with a new infection. Okay. What are the symptoms also, of course, the symptoms associated with the disease, how the disease profile is changing, which age group is more affected, these all the data or health trends the WHO is taking. Okay. So, these all the data are providing the technical support to the countries. Now, how the India is connected with it? So, India became a party or a member to the WHO Constitution on 12th of January 1948. Okay. The first session of the WHO Regional Committee for Southeast Asia. Okay. In the Southeast Asia region we have many of the countries, and out of it India is one of them, and the regional office, we will see the regional office of WHO for the Southeast Asia region. So, it is in Delhi. Okay. The first session of the WHO Regional Committee for the Southeast Asia was held on 4 and 5 October 1948 in the office of the Indian Minister of Health. And who inaugurated it? So, it was inaugurated by Pandit Jawaharlal Nehru, Prime Minister of India. Okay. And was addressed by the WHO Director General, and who was the Director General at the time? See, Dr. Brock Chisholm, this is a WHO Director General. Okay. Then India is a member state of the WHO Southeast Asia region, and the headquarter of the WHO office in Southeast Asia region is in Delhi. Yes. Then what are the core functions? See, the core functions include the following. what WHO is doing. So, WHO country office for India headquartered in Delhi with a country-wide presence. The WHO country office for India areas work are enshrined in its new country cooperation strategy. Okay. There is one of the strategy which is made in 2012, means this plan is for the 2012 to 2017, which is known as country cooperation strategy, and in this India is working in collaboration with the WHO, okay, which is known as CCS, country cooperation strategy. Under this there are so many goals. So, WHO is staffed by health professionals, okay, and who are working in this World Health Organization, okay. Of course, the World Health Organization is working on the health parameters, so the professionals are of course associated with these health professionals, like doctors are there, the other experts are there, support staff working at headquarters in Geneva. Okay, the main office of WHO is in Geneva, Switzerland, and there are 6 regional offices as well, and country offices are there. 6 regional offices, like for the Southeast Asia region, for Africa, for America, like this. Okay, so there are regional offices as well. Now, in carrying out these activities, okay, and fulfilling its objectives, WHO secretaries focus its work on the following 6 core functions. What are these 6 functions the WHO is performing? So, providing leadership on matters critical to health and engaging in partnership where joint action is needed. Partnership with the countries, okay. Then shaping the research agenda and stimulating the generation, translation, dissemination of valuable knowledge, okay. Making the norms, finding the research agenda, where should do the funds and in which area we require the research, and then stimulate the generation, okay. Then motivate or stimulate for the work, okay, for doing the research, so for the generation and translation of it, okay. The research we did, the findings we have, what we will do next is the translation of it, okay. Then providing the findings to others as well. So, WHO is doing translation and spreading of all of the valuable knowledge which the country will be benefited in the health aspect, okay. Then setting norms and standards and promoting, monitoring their implementation, okay. Now, with these the data or findings, we set norms or standards on which will provide the therapy to the patient. Now, what is next? We are launching any program in which there are some standards and we are promoting those programs. So, we have to monitor it, okay. Every time there should be a there should be a cycling of monitoring, okay. There should be a surveillance, there should be a proper checking up or tracking of the program, okay. Then only we will find, yes, what are the next step we need to do or do the changes in the program, okay. Then articulating ethical evidence based policy options, okay. So, everything should be evidence based, everything should be data based. Providing technical support, catalyzing change and building sustainable institutional capacity, okay. So, any institution which is working on the policy and norms that WHO has provided, okay, World Health Organization has provided, for that institution it is very easy to sustain, okay. How? Because every time WHO will change the policies accordingly, what the data are coming out from the monitoring part or what are the data are coming out from the surveillance of a particular program, accordingly there is a requirement of the change in the programs, and on that changes of course the population will be benefited, okay, with the choices, choices which are available. So, there is a they are providing the sustainable institutional capacity, monitoring the health situation and assessing health trends, how the trends are going, the cases are rising, okay, and the cases are declining, what are the reasons, okay. And if we just find the reasons why the cases are declining, we can implement in those of the areas where the cases are rising, okay. So, these core functions are set out in the 11th general program of work, which provides the framework for organization wide program of work, budget, resources and results, these 4 things. Okay. The work of the program, the budget of the program, the resources of the program, and what are the results of the program. Okay. And we have entitled a quote which is known as engaging for health, means health for all. Okay. So, engaging for health, it covers 10-year period from 2006 to 2015, under which we are providing the health to all. Now, WHO India Country Cooperation Strategies, CCS. Okay. Country Cooperation Strategy in collaboration with WHO and India. Okay. So, it is for the strategies for 2019 to 2023, and this is the time of transition. Okay. So, the WHO India Country Cooperation Strategy 1923, a time of transition, has been jointly developed by the Ministry of Health and Family Welfare of the Government of India and WHO Country Office for India, which is in Delhi. Now, see the Country Cooperation Strategy, CCS, providing the strategic roadmap. Okay. It is providing the advisory. So, it is providing strategic roadmap for WHO to work with Government of India towards achieving the health sector goals. In the later slides, we will see what are the health sector goals or which of the areas we have covered under the CCS. Okay. Country Cooperation Strategy for 2019 to 2023. Okay. Now, see WHO technical support to the Government of India in 4 strategic priorities. What are the 4 strategic priorities that WHO is giving support to India? Strategy priority number 1, accelerate progress on universal health coverage. What I told you, health for all. Universal health coverage means we want the health as a right to all. Okay. So, accelerate progress on universal health coverage, health insured. Every person will get the insurance, okay, health insurance. So, there are some points like implementing Ayushman Bharat. This is one of the scheme which is launched by our Prime Minister, Ayushman Bharat scheme, and under this we are providing the insurance, health insurance to people. Okay. So, implementing Ayushman Bharat, health and wellness centers are there, hospital insurance schemes are provided to people, and we are trying to extend it for all of the people. Monitoring and evaluation of health sector performance. So, the first strategy is the accelerate progress on universal health coverage. The other points associated with strategy priority number 1 are improving access to priority health services like immunization, okay, universal immunization. So, immunization should be provided, okay. Maternal health care should be given, child health care, that is why we have covered some programs, okay, like national program for national health intervention program for mother and child. So, and there are some programs like universal immunization program. So, these are the programs. What they are saying? They are saying just we have to provide these of the services to the this particular age group. Yes. So, maternal health care required, then child health care required. TB is one of the disease. Okay. Hepatitis is one of the disease we are covering here. Okay. Digital health ecosystem should be there, which means we want the digitalization in health sector. Okay, the launch of the softwares, the tracking of the data is all by these softwares. The equipments or the machineries we are using, that should be properly digitalized. Okay, we are getting the results early as early we can get. Okay, and then we will start the treatment as early we can do, so that we can prevent the disease in the early stages or will improve the patient's health, okay, or the complications. Then eliminating neglected tropical diseases, those diseases which are neglected tropical diseases. So, eliminate them, eliminate neglected tropical diseases and control of vaccine preventable and vector borne diseases. What are the vector borne diseases? Like dengue, okay, filariasis, malaria, So, for all of these diseases we want to eliminate them. This is under the strategy priority number 1. Then what is the strategy priority number 2? The main thing here is the promote health and wellness by addressing determinants of health. Okay. So, we want to promote the health, okay. We want to promote the wellness of the people by addressing some of the determinants. What are these determinants? See, the factors which are responsible for improving the health. Okay. So, we are focusing on those of the determinants like non-communicable diseases. Action plan should be there, okay, which are not transmitted from one to another. So, we want those diseases to control by changing the lifestyle or by the food modification, okay, by all these. Then environment health. Environment is also responsible for impacting the health, okay, including air pollution. So, we have to check on it, yes. Mental health promotion and suicide prevention. The society is responsible, yes, the society in which we are living, okay. Then nutrition and food safety. This is impacting, that is why we see addressing determinants of health. Okay. We are impacting on determinant which are affecting the health. So, nutrition is there, food safety, then road safety is also important. There many people are dying in this road accidents. Okay. So, road safety is important, tobacco control, okay. Then integration of non-communicable disease and environmental risk factors in the digital health information platform. Okay. So, here we are talking NCD and environmental risks because this is the strategy priority number 2, but of course, we want the digitalization in all of the programs to improve the health infrastructure. Yes. Then see the strategy number 3, better protect the population against health emergencies. Okay. So, here we are talking about the emergencies, health emergency. What could be the health emergency? Disease surveillance and outbreak detection. Okay. There are sometimes epidemic we have seen. Abruptly the number of cases rising up. Okay. So, these surveillance are required. Rollout of integrated disease surveillance program using a real time integrated health information platform. Okay. Means when the disease is reported, it should be reported immediately. Preparedness for and response to all emergencies and containment of, this is a major issue, antimicrobial resistance we have covered in this strategy priority number 3, in which the WHO is helping for India to control these all of the factors or parameters. And at last is the strategy priority number 4, which is enhance India's global leadership in health. Okay, how will enhance the India's leadership? So, by improving the access to medical products, it should be of assured quality, all of good quality. We have to develop and inform and sharing of the innovations. Okay. So, develop and information sharing of innovations in health practices to launch it at the district level, at the community level or the primary health centers. Okay. Strengthening India's leadership in digital health. So, we are focusing a lot on the digital health. Yes. Thank you so much everyone. I hope this is clear to all of you. We'll meet in the next session with a new lecture.